Thank you, Mr. Chairman, and thank you to all of the witnesses for your testimony here this morning. I do appreciate this hearing today and the hearings that have been announced this morning, but I do want to echo the concerns of many of my colleagues that have already been raised about this committee and this Congress's real failure to address the healthcare affordability crisis. And it's important that we also understand how we got here, because we have to connect the dots in this committee that a driver of this affordability crisis that we're now talking about comes from decisions that this Congress has made. Cutting Medicaid funding and eliminating the Affordable Care Act enhanced premium tax credits are a huge part of it. They're not the only drivers, but they're important ones, and they are things that we can actually change in here. And so I really think it's important, as Mr. Pallone has mentioned, as several other people mentioned in here today, we can vote to restore those premium tax credits today, this afternoon, and I intend to do that. And I think this is an important hearing, and I think that, as we talk about improving patient access to Medicare services, we have to understand what Mr. Lipschitz was talking about a little while ago, that the cuts that are being made by this committee, by this Congress right now, are also impacting Medicare recipients, and they are affecting their access to Medicare services as well. Cutting access to health care for millions of Americans, which is indisputably what is happening right now, is increasing costs for everyone across the country, and it is hurting Medicare recipients. So I have the privilege of representing many people who work in the Texas Medical Center, the world's largest medical complex, and many of the more than 120,000 people who work there live in my district and have warned me about how disastrous the actions of this Congress are for patients across the healthcare system. And in this case, letting the premium tax credits expire. Now, Texas already has the highest uninsured rate in the country. It's estimated that Texas will experience the highest coverage loss of any state with the expiration of the tax credits. And last fall, when we were still working on this, the Texas Medical Center institutions and our local Chamber of Commerce, the Greater Houston Partnership, sent letters to me and to everyone in our delegation outlining the impact that loss is going to have on our constituents. It is a bipartisan concern in the medical community and the business community and across our community that people are losing access to healthcare that they desperately need. And so I know most people in this room know how all that works, but the idea that hospitals are going to be forced to reduce services and staff, that patients are going to have to wait longer. This applies to Medicare recipients too. And so I appreciate the importance of what we're talking about here, expanding access to Medicare services. That's what we should be doing. But we can't have this conversation without acknowledging the harm that is currently being done by decisions that are being made by this current Congress and limiting access to healthcare for all Americans. So, Mr. Lipschitz, I appreciate the work that the Center for Medicare Advocacy does to promote access to quality health care for Medicare beneficiaries. I appreciated your answers earlier. And I just want to know if you can talk about, with the time we have, I'll have another question to submit, I think, to you for the record at the rate I'm going. But could you discuss how this increase in the overall number of people across the country who are not insured impacts access to care for Medicare beneficiaries?
Well, if you have a significant group of people that don't have insurance at all, it's going to be unaffordable for them, and many people will defer care until they absolutely need it. It'll increase pressure in emergency rooms. It'll increase pressure on frontline providers. It affects the entire healthcare system. When you have people who are uninsured and underinsured, it adds pressure across the board, including the providers who provide care to everybody, not just Medicare beneficiaries or Medicaid beneficiaries.
Okay, so it looks like you're going to give me time to ask you my other question, but I may have to take the answer off the record, for the record. But I do want to acknowledge one of the issues that you raised in your testimony about the wiser model, because that's one of the things I've heard about ever since I've been here from the physicians in my district, are about the problems with prior authorizations and prior authorization in Medicare Advantage in particular, and how it really slows down access to appropriate care, forcing physicians to spend a ton of time on the phone with insurance insurance companies instead of caring for their patients. And they are really concerned about the implementation of the WISER model, which is being implemented in Texas. So I'm going to submit a question for you on that for the record, but I appreciate your insights. I appreciate all of your time here today and all the work that you do. Thank you, Mr. Chairman. I yield back.